Hi everyone, and in this topic, I'll be discussing antidiuretics. Antidiuretics, we have an hormone called antidiuretic hormone, ADH. Is there any other name for that? Yes, the name is called vasopressin. The name is vasopressin. Now, we have two receptors, V1 and V2. Now, there are drugs which are agonist for V1. So, we have a drug which is V1 selective, and we have a drug which is V2 selective drug. The V1 selective drug, the name of that is called terlipressin. The V1 selective drug is called terlipressin, and you read the name vasopressin stands for vaso means blood vessel, pressin means constrict. So the V1 is mainly present in blood vessel and it can constrict the blood vessel. So terlipressin is used in the treatment of esophageal varices. It is used in treatment of esophageal varices because it has vasoconstrictor property. Now, can you tell me a drug apart from this which can also be used in esophageal varices and the drug start with O? Yes, it is called octreotide. That is also used in this case. Now, V2 selective drug, the name is called desmopressin. The name is desmopressin. Now, I will take up the next slide and explain where desmopressin is used. So the name is desmopressin. It is called the V2 selective drug. This desmopressin, it is used for central diabetes insipidus. It is used in central diabetes insipidus. For that, it is a drug of choice. And please remember, V2 receptors are present in the kidney and they will increase the water reabsorption. The second important condition where we use it is in nocturnal enuresis, particularly in elderly population, and in children, bedwetting. So these are the conditions. Why we use it in nocturnal enuresis or bedwetting? Because it decreases the urine by reabsorbing water. So if urine is coming lesser, so there is no question of nocturnal enuresis and bedwetting in the night. It is also known to increase the clotting factor, that is von Willebrand factor and factor 8. So it is used for hemophilia. It is used in the management of hemophilia as well as a disease called von Willebrand disease. So that is what we mean by desmopressin. These are the two major drugs what are important. Now, do we use vasopressin as a separate drug? Vasopressin, it is used to control bleeding. It is used to control bleeding. It is also used in hypovolemic shock. Hypovolemic shock, and it is also used in cardiac arrest. So in certain countries, the guidelines they use high dose of vasopressin in cardiac arrest, but the recent guidelines don't recommend use of vasopressin in cardiac arrest. But these are the uses where we use vasopressin, bleeding, hypovolemic shock, cardiac arrest. Now there is one more drug similar to that. It is called felipressin. Felipressin is used with local anesthesia. So if you want a suture and you don't want the bleeding, we use with adrenaline. If adrenaline is not there, instead of that we use felipressin. So please remember the main important drugs are terlipressin, and remember it is V1 selective, and desmopressin is V2 selective drugs. Now once we understand that, you need to understand a topic called diabetes insipidus. Now what do you mean by diabetes insipidus? The meaning of diabetes insipidus is patient is passing urine too much, so polyuria. Since he is passing so much of urine, he will also have polydipsia. So he will have polyuria and polydipsia. There are two problems in the central diabetes insipidus. One is called the central and one is called the peripheral. Now what is the problem in central? Central, the problem is no ADH. No ADH. That means the brain, that is hypothalamus, is not producing ADH at all. Then what to do? Give ADH. How do I give it? I give it in the form of the drug desmopressin. So desmopressin is the drug of choice for central diabetes insipidus. Central is also called by a name neurogenic. It is also called as neurogenic. Peripheral is also called as nephrogenic. Now, what is the problem in peripheral? The problem in peripheral is the body is producing ADH, but the problem is V2 receptors are resistant. So, V2 receptors are resistant or they are mutated so that the ADH cannot work. So, for peripheral, the drug of choice is thiazide diuretics. The drug of choice is thiazide diuretics. So please keep this in your mind. So thiazide diuretics can be used both in peripheral and central, but for peripheral, the drug of choice is thiazide diuretic. You can use thiazide diuretics, I'll repeat again, for both central and peripheral, but peripheral, the drug of choice is thiazide. For central, the drug of choice is desmopressin. Can I use desmopressin in peripheral? No, because desmopressin is nothing but ADH and it cannot work on V2 because V2 is mutated. The question is, sir, if thiazide is a diuretic, how come it will prevent diuresis? Because already there is polyuria, and you just told in the previous topic, thiazide is a diuretic. So there is a paradox for this. Thiazide diuretics have paradoxical effect, have paradoxical effect in diabetes insipidus. In diabetes insipidus. Now, what is paradox? We all know that sun should rise in the east, but if he rises from the west, then that is paradox. So, thiazide should be diuretic, but here it is acting as antidiuretic. How? Now, let me explain that. This is the nephron. This is the loop of Henle, the DCT, and the collecting duct. Okay. Now, what happens when I use thiazide diuretic? Thiazide diuretics, what is the site of action? The site of action is in early part of DCT, so they don't allow sodium to get reabsorbed, and there is loss of sodium. There is loss of sodium. There is sodium loss. Now, when there is loss of sodium, what the PCT will do is it will absorb more sodium. Sodium is absorbed more. To compensate for that, more sodium is absorbed. Now, when the sodium is absorbed, you know that water will also get absorbed. Now, when the water is absorbed, what happens to the urine? The urine decreases. So, there is decrease in urine and there is decrease in polyuria. So, this is the mechanism that is explained why thiazides act as antidiuretics in case of diabetes insipidus. I will explain again. Now, when I use thiazide, they will lose sodium. When there is loss of sodium, the PCT tries to absorb more sodium in the PCT. Along with sodium, water gets absorbed. What happens if water also gets absorbed in PCT? The urine comes down. And what we require in diabetes insipidus is to decrease the urine, that is polyuria. And that's the reason thiazides can be used for both central as well as peripheral. But they are the drug of choice for peripheral diabetes insipidus. Okay? Now, moving on to the next concept, it is called SIADH. So, SIADH stands for Syndrome of Inappropriate Antidiuretic Hormone. The problem here is the ADH is excess. There is excess of ADH produced. So, what happens if ADH is excess? Antidiuretic hormone, the water will be more and the sodium will get diluted. So, ADH acts on V2 receptor. And what should we do? To treat SIADH, we should block the V2 receptor. So, what are the drugs used for SIADH? The drugs, one of the older drug that is used for SIADH, it is called demiclocycline. So nowadays we don't use it, but historically it was used. Now the new drugs what are used for this are V2 receptor antagonist. So we use the V2 receptor antagonist and the name is called tolvaptan. So tolvaptan is a drug of choice for SIADH. Tolvaptan is the drug of choice for SIADH because in SIADH the ADH action is more and it will act on V2 and produces antidiuretic effect. And what should I do? I should block the V2 and that is done by V2 receptor antagonist, that is tolvaptan. That is the drug of choice for SIADH. Now let me tell you about vaptans. There is a vaptan called conivaptan. Conivaptan, remember these receptor which block vasopressin receptor, they end with vaptan. It is V1 and V2 antagonist. It's a V1 and V2 antagonist, and it is also used for treating SIADH. And also it is used to manage hyponatremia. So conivaptan is used to manage SIADH and hyponatremia, and the drug is given intravenous. One important drug which is very much trending is tolvaptan. Very important drug. Please mark this. Tolvaptan. Tolvaptan is a specific V2 receptor antagonist. It's a V2 receptor antagonist. Now this tolvaptan is used for, number one, it's a drug of choice for SIADH. Yes. Then tolvaptan is also used for one more condition, to correct hyponatremia in CHF patients. And number three, very important, it is also used in autosomal dominant polycystic kidney disease. So it is also used in autosomal dominant polycystic kidney disease, and in the trials it has shown to decrease the cyst size, and that's why it is preferred here. So remember, tolvaptan, very important drug of choice for SIADH. It is used to correct hyponatremia in CHF patient. And one important thing is it is used for autosomal dominant polycystic kidney disease. So these are the important aspect you need to remember in antidiuretic. So let me conclude. Antidiuretic hormone we already have, and it is also called as vasopressin. The V1 selective drug is called terlipressin. It's a vasoconstrictor used for esophageal varices. Desmopressin is a V2 selective agonist, and it is used for central diabetes insipidus as a drug of choice. Then the drug of choice for SIADH is tolvaptan, and for central diabetes insipidus it's desmopressin. Peripheral diabetes insipidus it is diuretics. So that is about antidiuretic hormone. Thank you all.